It's that time of year again, cold, dark, and depressing. If this goes through your head, then maybe you have seasonal affective disorder. Hi, this is 3-Minute Health. Today we are looking at the main symptoms of seasonal affective disorder, or SAD. SAD affects just over 1% of the population, but the milder version, usually referred to as the winter blues, is speculated to affect up to 20% of us. If you're interested, we have a companion video on how to combat SAD, and we will link it at the end of this video. SAD is a form of depression, and many of the symptoms are close to those found in other types of depression. We will concentrate on the 10 most common symptoms today. Number 1. Unexplained aches and pains. Do you find you have joint or muscle ache, even if you haven't been exercising? Number 2. Poor diet choices. Are you eating more carbs and sugar than you normally do? Number 3. Irregular sleep pattern. Is it hard to get to sleep, and then hard to wake in the morning? Number 4. Lack of concentration. Things you normally found easy are becoming more difficult. Number 5. Low self-esteem. You feel as though you can't achieve anything, personally or professionally, that would be regarded worthwhile. Number 6. Increased stress levels and irritability. You know things shouldn't upset you, but you just feel frustrated with some situations. Number 7. A feeling of hopelessness and despair. It's hard for you to see a brighter future. Number 8. Avoidance of social gatherings. Getting ready and going out just seems too much effort. Number 9. Loss of sex drive. Sex just seems like the last thing you want to do right now. Number 10. Relying on alcohol more than usual. Having a drink occasionally is not a bad thing, but have you noticed you might be drinking more in the winter? Like other forms of depression, the severity of symptoms can vary from person to person. You will find that the symptoms will appear to get worse the further into winter you progress, and then start to dissipate with the onset of spring. Our body's circadian rhythm is heavily influenced by the amount of daylight we encounter. As the nights get longer, the shorter hours of daylight can affect the production of serotonin. This in turn makes it difficult to regulate our moods. SAD is more common in young adults, up to the age of about 30, and also in women, with 75% of diagnosed cases being in the female population. In extreme cases, SAD can be dangerous and lead to thoughts of self-harm and suicide. If you think you are at risk, you should seek professional help. We have included a few links for mental health charities in the description below that may help. Thank you for watching our video, and we hope it was helpful.